Welcome to the deep dive. Today we're tackling a really big paradox: healthcare quality and patient satisfaction.
Yeah, it's huge. Healthcare is this massive, growing global industry.
Colossal, really. I mean, the U.S. alone spent, what, $2.9 trillion back in 2013? That's over 17% of its GDP.
Staggering numbers. But here's the thing. Despite all that spending, there's still so much criticism about quality, about outcomes.
That's the kicker, isn't it?
It really is. What's striking is that the U.S., being the highest spender among high-income nations, often, well, it sees the worst outcomes in certain areas.
Like chronic conditions,
Yeah.
obesity.
Exactly, and even infant mortality, especially when you compare it to places like France, the UK, Australia, Canada.
Wow.
It really highlights something critical. Just throwing money at the problem doesn't automatically buy better health outcomes, not if it isn't focused on what actually matters to the patient.
That makes perfect sense. And that really brings us to the core issue, doesn't it?
Which is,
Genuinely understanding and meeting the incredibly diverse needs of patients. It seems like a constant battle for providers.
it is, and this disconnect, it often leads to lower patient satisfaction and maybe, surprisingly, even higher costs.
Right, because ultimately your perception of quality as a patient, that's a huge factor in success for any healthcare organization.
So the challenge isn't just delivering care, it's delivering satisfying care. Especially when patient expectations are so complex, so varied, how do you actually capture that consistently?
And that's exactly where our deep dive takes us today. We're going to introduce you to the Kano model.
Ah, Kano.
Yes, a really powerful, kind of unique framework for understanding what truly drives customer satisfaction, especially in a complex field like healthcare.
Yeah, it offers a different lens.
So our mission today is to unpack how this model is actually being used, reveal some pretty surprising insights from various studies, and explore its potential to genuinely revolutionize your experience as a patient. Let's dig in.
Okay, so the Kano model, it was developed by Noriaki Kano, and it was inspired by Hertzberg's two-factor theory.
Right, Herzberg, motivators and hygiene factors.
Exactly. And Kano's model fundamentally shifts how we think about customer satisfaction. You might know the core idea, the relationship between quality and satisfaction. It's not always a simple straight line.
It's not linear. More quality doesn't always equal more satisfaction.
Precisely. Not across the board, anyway.
So it's not just about adding more features or piling things on. It actually categorizes quality attributes into 5 distinct types.
And understanding these is really the key, I think, to unlocking patient delight.
Okay, let's break them down. First up, must-be attributes.
Right. These are the absolute basics, the non-negotiables. Think of them as table stakes.
So if they're missing.
Extreme dissatisfaction. But, and this is important, their presence just means basic expectations are met. It doesn't create delight. It just, stops you from being angry.
Got it. So examples.
Well, accurate medical care, patient safety, even something like reliable meals in a care home. If those aren't there, you're deeply unhappy.
Makes sense.
Yeah, one study actually identified the basic presence and competence of nursing staff in a public hospital as a must-be. You just expect them to be there and know their stuff.
Okay, what's next?
Next are one-dimensional attributes. This is where it is more linear.
Ah, okay. So satisfaction is directly proportional to performance.
Exactly. The better these are, the happier you are. More is definitely better here.
So like where?
Things like empathic staff, opportunities for social interaction, support for daily living activities in care homes.
Great.
A Greek study highlighted that healthcare facility employees telling patients exactly when services will be performed, that was one-dimensional. The clearer and more timely that info, the higher the satisfaction.
That makes sense. Clarity matters.
It does. And another study, this one on a new perinatal center design, found that effective communication between, say, aftercare wards and neo wards was also one-dimensional. Better communication, higher satisfaction.
Right. And then, this is the really interesting category, I think. Attractive attributes.
The delighters. Yeah.
These are the unexpected qualities, right? The things that elevate an experience from okay to wow.
That's it. Their presence leads to extreme satisfaction, that wow factor. But crucially, their absence causes no dissatisfaction at all.
You don't miss them if they're not there.
Exactly. But when they are, that's when you're truly impressed. These are the elements that really differentiate.
So what kind of things fall into this category?
Well, studies found things like a home-like environment in a care home, Suitable design, accessible equipment, these were seen as attractive.
Nope.
Or for migraine patients, achieving total pain disappearance, that was
Mm-hmm.
considered attractive. It's not always the baseline expectation, maybe, but when it happens, huge satisfier.
I can imagine.
Yeah, and even the medical personnel in a Greek hospital were sometimes seen as an attractive characteristic, suggesting their demeanor, their service, just went above and beyond basic expectations.
Interesting. Okay, so that's 3. What else?
We also have reverse attributes. This one's a bit of a head scratcher sometimes.
How so?
Well, here, the absence of the attribute actually leads to satisfaction.
Ah, so less is more.
Kind of. Think about fewer unnecessary forms to fill out, or maybe shorter wait times to see a specialist.
Right. Removing a negative creates a positive.
Exactly. It's when removing or reducing something undesirable actually creates happiness.
Got it. And the last one.
In different attributes, these are the elements that just have no effect.
Yeah.
Either way, satisfaction or dissatisfaction, they don't move the needle.
So they're just there.
Pretty much. An example from one study, for care home residents, involvement in certain specific decisions was found to be indifferent. It just didn't impact their overall satisfaction.
Okay, so those are the 5 categories. Why does this matter so much for healthcare then?
Well, the core insight here is that implementing the Kano model lets providers really understand the complex, often nonlinear behavior of patients, their specific needs.
Which leads to more targeted improvements.
Exactly. More targeted and more effective improvements in patient satisfaction, hopefully without just adding cost everywhere.
Okay, let's see how this actually plays out. You mentioned studies. Even the early implementations, just using Kano on its own, gave some fascinating insights.
Yeah, absolutely. Take cultural differences in care. There was a really interesting study comparing hemodialysis patients
Why?
across several Arab countries, Saudi, Syria, UAE, and Austria. And it revealed something pretty profound.
Which was?
How much cultural background and even literacy rates significantly impacted what drove satisfaction.
Really? How so?
Well, Arab patients often showed higher satisfaction coefficients, more one-dimensional responses, meaning if the service was there and decent, satisfaction went up proportionally. Austrian patients, though, reported more must-be and attractive responses. This suggested a different baseline of expectation, perhaps influenced by different healthcare system structures, maybe service monopolies in some Arab countries at the time.
So expectations aren't universal.
Not at all. They're deeply rooted in culture. It really showed that a one-size-fits-all approach to patient satisfaction. It's just fundamentally flawed.
That's a crucial point. Patient perception is so nuanced. And speaking of different perspectives, what about patients versus providers? Do they see eye to eye?
Often, no. Not entirely. There were deep dives into osteoarthritis and migraine treatments in Spain that really brought this difference to light.
What did they find?
Patients overwhelmingly prioritized efficacy. They wanted total symptom disappearance, lasting relief. Make the pain gone.
Understandable.
Very. But the physicians and neurologists, they prioritized safety, the absence of long-term adverse effects.
A potential conflict there.
A significant one. It's not a minor difference. It's a fundamental disconnect in what counts as a successful outcome.
Which raises a big question.
It does. How can we make sure patients are truly involved in treatment decisions so that the care aligns with their priorities?
Yeah.
It's about genuine value co-creation, not just top-down delivery.
Absolutely. Value co-creation. And speaking of involvement, there was a study in Sweden in a children's and women's healthcare department.
Yes, that one explored various patient roles, not just patients as passive recipients, but also as suppliers, participants, even co-designers of their care.
Interesting.
And they found that gathering input from everyone, patients, relatives, and healthcare professionals together was essential, especially for identifying those complex, diverse needs, like when they were designing a new perinatal center.
So you need that holistic perspective.
You really do. And the Kano model becomes even more powerful when you start pairing it with other quality tools.
Like what?
Well, consider Kano plus quality function deployment, or QFD.
QFD. Remind us what that is?
QFD is basically a systematic method. It helps translate customer needs, what patients actually want, into concrete functional requirements, technical specifications for a service.
So it bridges the gap between desire and design.
Exactly. It's like building that bridge. But, without Kano, you might accidentally prioritize improving a must-be that's already adequate instead of investing in a potential delighter.
So Kano tells you which needs matter most, and QFD tells you how to meet them.
Precisely. Kano plus QFD ensures you're building the right bridge to the right kind of patient satisfaction, prioritizing those attractive qualities.
Makes sense. Are there examples of this pairing in action?
Yeah, several studies use this integrated approach. For instance, a framework developed in Taiwan. It helped providers classify needs using Kano, prioritize them giving attractive qualities the highest importance, and then translate them into practical service requirements using QFD.
Okay.
And in a Malaysian doctor care facility, this pairing found, again, that patient expectations differed from providers. Patients put the utmost importance on ethical healthcare providers.
That ethical dimension again, really crucial.
It underpins everything, doesn't it?
Yeah.
Trust is fundamental. And in UK care homes, this integrated approach was used to identify attractive needs like accessible equipment, a home-like feel, suitable design, alongside the must-be's like meals and safety.
And it helped prioritize.
Yes, it helped them figure out which improvements would make the biggest impact on resident delight, not just basic needs.
Okay, so Kano plus QFD. What other pairings are powerful?
Then there's Kano plus ServQual.
ServQual, that's a pretty widely used quality assessment tool, right?
Right.
Measures gaps between expectations and perceptions.
It is very common. But its limitation, traditionally, is that it assumes that linear relationship between quality and satisfaction, which Kano shows isn't always true.
So combining them fixes that.
Exactly. Combining Kano with ServQual eliminates that drawback. It gives you a much richer, more nuanced understanding of patient perception. You see the must-be's, the one-dimensionals, and the delighters all within that expectations perception framework.
So you get a really complete picture.
You do. Studies in Greece using Kano ServQual found patients highly valued things like the personal knowledge demonstrated by staff, the courtesy of hospital employees, their ability to convey trust and confidence.
The softer skills.
Very much so. They also identified personal attention and being told exactly when services will be performed. That came up again as having a really significant impact on satisfaction.
Interesting. Any other striking findings from Kano ServQual?
Yes, especially related to medical tourism.
Okay. How so?
One study using this combined approach in a private international hospital in Thailand revealed something fascinating. Quality attributes were perceived very differently depending on the patient's nationality.
Really? Like Japanese versus Thai versus Arab patients?
Exactly. Japanese, Myanmar, Arab, Thai patients, they all had significantly different levels of satisfaction associated with various attributes.
Wow. So what's the big insight there?
The core insight is that for medical tourism providers, a generic strategy just won't cut it. You absolutely need tailored improvement strategies based on nationality and cultural background. What delights one group might be a must-be, or even indifferent to another.
That makes a lot of sense. You have to know your audience.
Absolutely. And another study suggested that in really competitive healthcare markets, providers should strategically focus on creating those attractive qualities.
The delighters.
Yeah. Not just meeting the must-be's or improving the one-dimensional stuff that everyone does. To truly differentiate, you need to find ways to delight.
Stand out from the crowd.
Exactly. It's about going beyond the basics.
Okay. So we've seen Kano plus QFD, Kano plus ServQual. Are there other integrations?
Definitely. Kano's been combined with other useful methodologies, too. For instance, Kano plus service blueprinting.
Service blueprinting.
Yeah.
That maps out the entire service process, right?
Yeah.
Customer actions, staff actions, support processes.
That's the one. In a Taiwanese adult daycare facility, integrating Kano helped them analyze their service blueprint. They identified 17 attractive service elements out of 21 they examined.
17 delighters. That's a lot.
It is. It showed where they were really adding unexpected value.
Yes.
It also flagged transportation services, specifically things like availability, staff demeanor, driver attitude as a critical one-dimensional attribute.
So performance there really mattered.
Critically. And this allowed them to redesign their service blueprint to specifically enhance those transportation touch points and better leverage those attractive elements.
Very practical application. What else?
How about Kano plus Herzberg's two-factor theory? We mentioned Herzberg earlier.
Right, the inspiration. Hygiene factors and motivators.
So a study in India actually used both together to investigate something interesting, the possibility of a third quality factor.
A third factor.
Yeah, they were looking for elements that might affect patient satisfaction in ways that didn't neatly fit either the must-be hygiene or attractive motivator categories alone. They found factors that seemed to exhibit characteristics of both.
So blurring the lines a bit.
Kind of showing that sometimes an attribute can prevent dissatisfaction and actively create satisfaction. It's not always strictly one or the other, a more complex relationship.
Fascinating. Okay, one more pairing maybe.
Let's do Kano plus AHP, the analytic hierarchy process.
AHP. That's a decision-making tool.
Hmm?
Helps prioritize complex criteria.
Exactly. It's good for structuring complex decisions. For the Korean medical tourism system, an integrated Kano AHP approach was used to develop a robust framework
Dual purpose.
for managing the service system requirements. But the real insight here was how it enabled value co-creation among all the stakeholders.
Not just patients and providers.
No, everyone.
Right.
Government bodies, service providers, support industries, and patients. It fostered a truly holistic view of satisfaction and how to achieve it system-wide.
That sounds incredibly comprehensive. So, pulling all these threads together, why is Kano becoming so important right now in healthcare?
Well, there are several driving forces. You've got the rise of medical tourism, as we discussed. There's the aging global population with complex needs.
The growth of corporate care homes?
Right, bringing more business-oriented quality approaches.
Yeah.
And even economic pressures, recessions, forcing providers to deliver better care more affordably.
So Kano helps understand evolving needs in this changing landscape.
Precisely. It helps pinpoint where to invest resources for the biggest impact on satisfaction and value rather than just, guessing or doing what's always been done.
And connecting this to the bigger picture, it feels like the adoption of Kano reflects a shift in how we see the patient.
I think that's absolutely right. It signals a move away from the patient as just a passive recipient of care,
Towards being an active contributor.
an active participant.
Exactly, an active contributor in their own care delivery. It's about empowerment and recognizing that the patient's perception, their experience, is paramount. Now, geographically, where is this happening most? You mentioned Asia and Europe.
Yeah, the review we looked at found that most empirical Kano implementations in healthcare, at least up to 2016, had occurred in Asian countries, followed by European nations.
Which leads to that surprising fact about the U.S.
Really is surprising. Despite countless quality improvement studies in U.S. healthcare, the review found no empirical Kano model studies conducted there during that period, 2002 to 2016.
Wow. For a country spending so much and so focused on healthcare debates, that's a huge gap.
It really begs the question, why the lag? Especially given its clear utility shown elsewhere.
Are there limitations, maybe, in how it's being applied currently?
There are some. Current research often applies Kano to, say, one specific service unit, like an ER department, or maybe applies it generically across a whole hospital system.
Rather than comprehensively.
Right, rather than comprehensively exploring all the different service units within a system and how they interact to create the overall patient experience, there's definitely room for more holistic studies.
So this deep dive really underscores the need for more research using Kano.
Absolutely. There's an immediate need to use it more widely to understand these complex patient needs, to improve the quality attributes we already have, and importantly, to innovate new, attractive attributes, the delighters.
All while keeping costs in check.
That's the challenge. And it's critical because, as we've touched on, many existing healthcare quality frameworks, they just don't give enough insight into that vital gap.
The gap between patient perception of quality and their actual experience.
Exactly that gap. The Kano model has real potential to bridge it, to connect what providers do with what patients truly value.
So this deep dive really reveals that genuine patient satisfaction, it's not just about ticking boxes and meeting basic needs.
Not at all. It's about identifying and delivering those surprising, unexpected, attractive qualities, the things that truly delight and differentiate. It's about seeing beyond the purely functional or expected.
So a final thought for you, our listener. As you reflect on your own experiences with healthcare, maybe think about this. What specific attributes would you classify as attractive?
Yeah. What were those unexpected elements, big or small, that truly enhanced your experience, made you feel genuinely cared for, not just treated?
And taking it a step further, how can we, as patients, as advocates, actively contribute to shaping a healthcare system that doesn't just meet our basic expectations?
But one that consistently delivers those delightful, value co-created moments. Food for thought.